Everybody. For those who don't know, I am Dr. David Berger. I am a board certified pediatrician in Tampa, Florida. Welcome to my YouTube channel. And this is our monthly Ask Dr. David live event where we take questions from the community. We first get questions from our Patreon subscribers and our YouTube subscribers, and then we open it up to people who can put questions out there as part of the chat in this event live as well. Now, anything that we do talk about, this is for general education purposes. This is not specific to any one given person. Everybody, of course, has their own uniqueness and their own individuality. And of course, more specifics should be brought to a patient's healthcare provider. And for those who don't know, we do offer consultations both in the state of Florida, as well as I offer health educational consultations for those who are outside of the state of Florida, so I can provide the information that people need. Pardon me, I have a hiccup there. Okay. Also want to put out there that for those who don't know, that we did recently start doing a podcast. We realized that some people prefer to get their information in an audio format as opposed to in a video format. Kind of sometimes it's easier for people. So we are doing that as well. Okay, so let us get started. So first thing, you had mentioned recently, pardon me. You mentioned recently that you follow a plant-based diet regimen about 80% of the time. Can you please provide some examples of vegan foods and snacks that you eat on a regular basis? Oh, that's cool. Okay, so first of all, just for those who know, a plant-based diet is keeping vegan most of the time. So there's a little bit of difference there, but 80%, 85% of meals kept in a vegan mode, and then something animal-based can be in there. Now, of course, a person who is vegan is, of course, a plant-based diet, doing it to the next level. And so the general idea is the same there, though, but it is felt that a plant-based diet can, one of the main reasons why people will do this is lowering inflammation. Now, in terms of some of the snack foods that I like to have, so one of the things that we do try to avoid, that I do try to avoid, are processed foods, and processed grains, etc. I do allow grains in my diet. Probably my my preferred crunchy snack food would be like an organic tortilla chips, corn. My body does not have a problem with corn since I got my vitamin D level rectified many years ago, and I used to have terrible allergic reactions to corn. But that's definitely my favorite crunchy snacky food and salty food. I do like to slice up peppers, different peppers. I'm not a huge green pepper fan. I know some people do, but I do like yellow peppers and red peppers, and what I will do, and orange peppers. I love those too. And I also slice them up, and I'll do different hummuses. There's so many different varieties of hummus out there. I've gotten recently into the carrot sriracha hummus that's out there, but all the different types of out there, kind of making it a little bit interesting. That's certainly very nice. I do like to do nuts and seeds in my diet as well, and dark chocolate. Dark chocolate definitely up there. I typically use dairy-free versions that are out there. The higher the cacao, the lower the sugar content in there. So I try to get I do at least 60% cacao. Sometimes I'll go into a 72%. With that, a lot of these also have these higher cacao products also have some fiber to them too. So you kind of get a little extra fiber out of them as well. Another one of the there's a product that I've liked. It's called Catalina Crunch. It's a brand, and they do make these keto-based cereals that very nice and clean. Pardon me, let me turn that off. Didn't mean to have my phone on there, so sorry if I blew you out of there. So that's something that I'll do, and I like to snack it with putting some berries on top, to using some almond milk or cashew milk as the white milky substance. That's one of my favorite snacks as well. I also like snacking on nut butters. Of course, the lower the sugar, the less processed, the better. So that's kind of like the foods that I like to eat on my diet. Okay. In addition to following a primary plant-based diet, do you also limit or avoid gluten? And can you please share your medical advice on the effects of gluten in people prone to inflammation? Okay, so I do not consume a lot of gluten in my diet on a daily basis. I don't. There may be something once a week, or like I was at the ball game, and I did have a little bit of of a soft pretzel there just because it looked good and I wanted it. We were kind of doing something a little different, but I don't have a lot of gluten in my diet. I do eat some plant-based foods that have gluten in it. So for some of the meats alternatives, as you may know, it is kind of tough to do a meat alternative that doesn't have soy or gluten in it. I don't do that much of it, but that's certainly probably the areas that I will get it. But I'm also one who doesn't have a problem with gluten, and that's of course a very important aspect of things. There is no such thing as a perfect diet. Okay, if you tried to follow every single diet that's out there, you'd probably be stuck with water as your sole sustenance. And so, we all hear about these great diets. There's the keto diet, there's the anti-inflammatory diets, Mediterranean diets, etc. And it's a matter of there's some trial and error involved. Now, because of the fact that my body doesn't react to gluten, I don't have any GI issues from it. I don't get any allergy types of symptoms. I don't get any depression or mental health or any more than my baseline ADD symptoms that I have. But of course, for everybody, it's going to be different. So if a person is consuming gluten and they're having a negative reaction from it, that's important. Doing an elimination diet, which we encourage people to remove all of the potentially allergenic food, and then bring them back one at a time to see if there's a negative reaction. That is a document that we have in our Patreon account. For those who are members of our Patreon, we have the details of our elimination reintroduction diet there as well. So that's kind of how I approach it from that. Now, gluten as well as casein, which is the cow milk protein, both can in certain people induce hyperinflammatory and autoimmune reactions. The quintessential one for gluten seems to be with Hashimoto's, the autoimmune thyroiditis. Gluten certainly seems to make those worse. One of the things that we have found in some of our children on the autism spectrum, as well as people with epilepsy, are the presence of cerebral folate receptor autoantibodies. This is a test that we can do. When people have this issue, they need to take significantly higher levels intake of activated folate to get it into the brain if the receptor is clogged up. But casein protein in particular does seem to make that worse. Now, I know you'll hear about other types of milks. Like a lot of people talk about how camel milk is actually have anti-inflammatory properties, but it does have mammal casein in it, so that can be a little bit confusing and a little bit of a trial and error. Okay. So in terms of inflammation, overall health, and longevity, can you please explain any differences in following a plant-based diet versus a dairy-free and gluten-free diet that allows for things like meat and eggs? Which plan would you recommend for someone that has autoimmune concerns? Okay, well, we're getting some good diet questions here. So, first, I won't talk about longevity. I don't think any of these diets have been around long enough where we could talk about expanding lifespan here. And obviously in the pediatric world, I would be dealing with many more people on the earlier side of life as opposed to the end of life. So I'm not going to talk specifically about longevity. Okay. But in terms of inflammation, and one of the things that we talk about sometimes is what's called an anti-inflammatory diet. And there are actually different versions of this. I think that the most simple as well as the most studied is the Mediterranean diet. Okay. So, but there are certain foods that promote inflammation, and that would include refined carbohydrates. So processed flours, white breads, pastries, those types of things. Fried foods, okay, even if they're vegan foods like French fries, they're still fried foods, and fried foods do have pro-inflammatory components to it. High sugary foods, sodas. We now are learning more about how dietary sodas may not be any better, may actually cause other problems for people. So, certainly people do seltzer waters and flavored seltzer waters and stuff like that. That's different than a sugary sweetened or a artificially sweetened drink. Red meats themselves, burger, steaks, etc., mammals, and especially processed meat like hot dogs and sausages and some deli types of meats can be problems. And then also saturated fat types of oil, so margarines, shortenings, and lard. Those are all foods that promote increased inflammation. Then there are other foods that have anti-inflammatory effects, things like tomatoes, olive oil, and other omega-9 foods. So for some people, omega-6s, like such as in nuts and seeds, can be a problem. So one of the things that we do on our genetic methylation and nutritional genetic testing that we do is we look, because some people actually can create increased inflammation from omega-6 fatty acids. So that's one of the reasons, among many, why I like to do this max function test for maximized genetics, because it will tell us if a person's more likely to convert omega-6 fatty acids into pro-inflammatory cytokines, interleukins, etc. If you don't have that issue, then omega-6s are going to be fine, and obviously that's a nice source. I can think of nuts for a lot of people as a kind of like a superfood, because you do have some carbs in there, but it's not refined. You do have your proteins in there, you have your fats in there, healthy fats, so it's kind of a nice little superfood there. Now, fatty fish, things like sardines, salmon, those can be very helpful because they're going to be very nice in terms of the omega-3 fatty acids, which we know are also anti-inflammatory. Certain types of fruits, a lot of the berries, cherries, oranges, things that are high in vitamin C, things that are high in bioflavonoids, those are going to be very, very helpful. Now, if one wants to try to put this together, and you've probably heard of what's called the Mediterranean diet. Well, I mentioned it a few minutes ago, so you heard it there. But a Mediterranean diet, it kind of incorporates all of that. So if you're kind of looking for something, this is probably the thing that's been most studied. I know that Harvard University's med school talks about this a lot. So that would be kind of a good basic idea as what to follow. But at the same time, there could be lots of other foods. As I mentioned, doing an elimination diet may be necessary. Some people may not be able to handle whole grains, may not be able to handle legumes. So really, talking to a healthcare provider, trying to sort this thing out, trial and error, doing something for a few weeks doesn't make a difference, if not moving on. In general, that's kind of the way when I counsel my patients, the way we kind of look at this whole thing. Okay. And again, when it comes to legumes, when it comes to grains, it really just depends on the individual. Not everybody is going to promote inflammation. It's not always pro-inflammatory for people. What is your medical view on following a regimen that restricts carbohydrate consumption, like a keto plan, and whether there are truly any health benefits to doing so? Okay. So when a person is having a low carb to no carb diet, once carbohydrates are burned, then our body starts burning fats and creating energy through the production of these ketones. Now, this is really phenomenal. And this is something that this was actually the very, very first holistic thing that I ever learned about. This is going back to about 1995, back at Tampa General Hospital. There's a particular form of really terrible seizures that happen in young children called infantile spasms. And I was working in the developmental clinic there doing my rotation, and a family had come in, and they had recently gone up to Johns Hopkins, where they had instituted this ketogenic diet. And these kids had no seizure medicines hasn't worked. They were talking about doing brain surgery to try and help. But they went up there, they worked with a nutritionist, and they did a keto diet, and the kids stopped having seizures. I had seen the patient afterwards, and and then this kid just developmentally and the seizures, everything just really perked on. So this is way before I started learning about autism from a biomedical dietary perspective. So it does seem, however, that these keto diets can help other types of neurological and behavioral types of conditions. So going on a keto diet, but it is something that one should be working on with a healthcare provider who knows what they're doing. But literally the production of these ketones do seem to have a change in the neurology, in the biochemistry of the neurology, that can make a difference. So that for sure is one reason. Now, a keto diet is also a good way for people to lose weight. The question is it sustainable? Most people who I know who have had success with the keto diet eventually gave up with it because they just thought it was too hard. But as long as somebody's getting all the nutrients necessary, it can be very helpful for some people in terms of losing weight. But I do think that there are lots of other ways of losing weight if that's not the answer for a particular individual. Okay, so let's see, what do we have here next? I have an upcoming surgery, a laparoscopic hysterectomy. It will be my first time under anesthesia. What is the best way to detoxify my system after the surgery to rid my body of the ill effects of heavy pain medication and anesthesia? Okay, so first of all, it should be understood that most of those medicines do not last in the body in a very long time. So if a person is able to detoxify properly, most people will clear those. Now, coming back to this maximized genetics test. So when a person, you've heard me talk before about MTHFR and the need potentially for activated folate called methylfolate, incredibly important for liver detoxification. Other, methyl forms of B12, making sure that people are using the right amount of B12. And for that type of liver support, it can be very, very helpful. Now, in addition to that, certainly being well hydrated beforehand, well hydrated after, letting things flush through the system is important. Doing things, so not drinking beforehand or doing other things like taking Tylenol beforehand, in order to make the liver be as strong as possible to handle those types of toxins, that can be very helpful as well. But of course, people do need to have pain medications and anesthesia to properly get through it. So obviously, in a perfect world, the person wouldn't need to be having surgery in the first place. But that's one of the things that's helpful. I do encourage people, if they are having issues with methylating B12, to create methylcobalamin. Taking methylcobalamin potentially as an injection beforehand. We do this in every 3 days for some people, of giving them methyl B12 injections. I think taking it beforehand, if that's an issue, that can be very helpful because it will stay in the body. I've had people who have not responded well to anesthesia, who after the fact we've given them a shot of methyl B12, and I have seen that turn things around as well. And then taking glutathione, at the end of the methylation transsulfation pathway, our body produces N-acetylcysteine as well as glutathione. And I think taking both of those can be very helpful as well in terms of speeding up the detoxification process. Okay. Do you have any recommendations for what helps treat acne? Okay. So acne is a combination of a bacteria, clogged ducts that lead to inflammation. So there's a couple aspects to this. So first of all, doing very mild facial scrubs to kind of help keep pores open, that can certainly be helpful. Okay. If there's inflammation, and if it's bad inflammation, there may be a need to do something more anti-inflammatory, like a benzoyl peroxide, the old Oxy 5, Oxy 10, in order of getting things under control. Okay. Now, one of the things that I have found that can be helpful for this Melaleuca, can sometimes be very helpful for as well. I haven't found a ton of great acne medications, but anything, again, would I certainly try a Mediterranean diet for the anti-inflammatory purposes? Absolutely. Would I be looking to gut health? Again, one of the things that actually I didn't mention before, but, not just the gut health, but, looking at the gut pathogens. Is there any candida presence or anything that could be creating increased intestinal permeability, or the layman's term of leaky gut, things getting into the bloodstream that can create inflammation? But as again, kind of like as we talk about with so many other aspects of things that cause chronic health problems, it all comes back to inflammation. Whether we talk about long COVID, it's inflammation. People who get to more serious effects with COVID, again, inflammation, cytokine storm. So everything that we can be doing in the long term to try to keep our inflammatory systems in balance. Of course, we need to have some inflammation to fight off infections. So we're always kind of looking for that Goldilocks effect as well. But, yeah, so for some people that could be helpful as well, but it can be challenging. It certainly can be. I have a 13-year-old son, and I'm curious to get your thoughts on growth hormone related peptide to assist growth. So actually, this is something that I've never prescribed before. This is something that the endocrinologists really get into that. I have to say I'm not overly versed. I've certainly seen endocrinologists do this. This is certainly one of the things when we are doing a slow growing or non-growing child. Certainly looking at that and insulin like growth factors, growth hormones, thyroid hormones. All of those things are part of that type of working up, of course, as well as making sure that they're getting all of their macro and micronutrients tended to on a relative basis. But I know it is something that that the endocrinologists do, but it's something if I'm seeing hormone deficiencies like that, I'm not the primary person who's doing that. I'll help people along and of course support everything else, but that's when we want our friendly endocrinologist to get involved. All right. I've heard that they are expecting this to be a bad flu season. 2 questions. Do you take a flu vaccine? And do you have any personal guidance for this year's flu vaccine? Okay. So I have an interesting history with influenza. Now, back in medical school, when we're talking about early 90s, certainly all of the residents, all the med students, excuse me, had, and also residents when we were at the hospital, we had to take flu shots. So it was one of those things. So this is well before I had my holistic inclinations and learning and things that I had taken many times and I had no problem with. Now, as the years went on, I did start to think maybe I don't need to take a vaccine. But what has happened is twice in the past decade, I've caught influenza. My body does not play well with that viruses. I handle almost every other virus amazingly well. It's rare that I'm sick for more than a day. It's rare that I'm running fevers. But I don't know what it is about this particular category, this family of viruses, influenza. I have gotten twice encephalopathic from it, where literally I'm not able to think properly. It feels as if my brain is on fire. I've lost hearing from it. I have had ringing in my ears that have lasted for a long, long time. I have had not just sweating from when I had a fever. I've gone weeks afterwards where I'll just start breaking out in a sweat. This happened with me once when I was with a patient, and the patient's like, "Are you okay?" I mean, like a fire hydrant, just like literally just pouring off of me. And I have literally had to be out of the office for up to 2 weeks before for this. So for my own person, when I assessed the potential risk versus benefit, the potential of how bad I felt, and as well as, being out of the office for up to 2 weeks and not being able to take care of people, for my own personal body, I've assessed that the benefit of this vaccine outweighs the risk. So I have taken it of more recent in the past decade. Now, as far as this particular flu vaccine, so as you may know, this is all a bunch of guesswork, educated guesswork, but they try to predict which strains will be in circulation based upon what happened the year before, as well as based upon what happened in the Southern Hemisphere 6 months prior, where their winter is our summer and vice versa. Now, of course, we saw very little influenza last year, as well as the year before. That's because people were taking different measures, whether they were wearing masks or staying home, or of course during the quarantine or when schools were closed. So there wasn't nearly the same amount of germs being passed along. And so we didn't see that. So part of the reason why it's felt that this could be a bad flu season is that very few people have had influenza in the past couple of years. Now, one of my incorrect predictions last year is I thought that last year was going to be a terrible flu vaccine, because by then, at least here in Florida, most people by last winter time were kind of returning to normal life and normal exposures, etc. Not fully, but it was there. And we were wrong. So is it possible that the prediction is going to be wrong again this year? Certainly possible. We have no way of doing that. No crystal balls to predict the future. But, just understanding basic virology, you would expect that this is going to rear its head. There have been some communities, not really here in Florida, but there have been some communities starting to see influenza a little early so far this year. And that does not predict what's going to happen going forward. It's not going to predict what's going to happen here in Florida for those of us who live here. But in terms of any guidance for this, there's no way I can tell you, how likely is it going to work for people, keeping in mind that although the immune support protocol didn't work for me for this, and having good vitamin D levels did not work for me for this. If you look at the research clearly does indicate that for more having optimized vitamin D levels and zinc levels, and of course, I'll still always put a plug in for our immune support protocol that we have on our Patreon account that I've posted on previous videos before. That, of course, in our useful info section for our patients, that for most people, they do perfectly fine with it. I've seen this work great for my kids, and they haven't been vaccinated for influenza. So yeah, so it's going to be individual thing, but as of right now, though, for me at least, asking the question about me, will I take one this year? I probably will be taking one this year, just because I can't go through another event like I've had before. Okay. So there was also a question about because, as you may know, of course, what's being encouraged by the powers that be are both influenza vaccines as well as the COVID booster. So this question, if I do get them at the same time, is there any special prep I should do beyond the vaccine prep? The answer is no. Okay. Now, of course, if a person has chosen in the past to take influenza vaccine and did fine with it, and if a person has chosen to take the COVID vaccine in the past and did fine with it, are they probably going to be okay with getting both vaccines at the same time? Probably. This is my baby food. First, you eat peas, and if you're fine and you eat carrots and you're fine, you can have peas and carrots type of thing. Our immune systems are clearly capable of handling more than one infection virus at a time, where we can handle lots and lots of them. So that's not a concern. But of course, if it were me, do I think that's taking them individually? Because obviously no one has done those before. And, to me, if I had an opportunity to do them split up versus taking, if that was the binary choice that was presented to me, I guess I would rather split them up just to kind of let my body deal with it. But if push came to shove, I realized that some people may only be able to get to a doctor or pharmacy sporadically. Some people may just want to get it over with all at once. That'll be their personal, individual decision. But, we just don't know. I personally don't know of anybody who has taken both of them at the same time. We aren't going to have any data on that for quite some time, if they're going to give us, because let's face it, one of the most disappointing things about what happened with COVID is the lack of data that has come out overall on so many different things. So yeah, I guess that would be my take on it. Okay. Waiting for the next one to roll on here. Okay, we are going away from immunology here for a while. Do you recommend GABA for anxiety? Okay, so for those who don't know, GABA is a natural, we all make it. It is a neurotransmitter that is considered an inhibitory amino acid. So you heard about glutamine or glutamate, that can be pro-inflammatory, but GABA and pro-instigate. But the GABA is actually the opposite. And so when a person takes a benzodiazepine, like a diazepam, which is Valium, or a Xanax, etc., those medications are hitting the GABA receptor. And that's how they work, by lowering the anxiety. Of course, it's clear that we know that those medicines do that. Now, people can take GABA as a supplement. Now, in the mainstream world, I hear people talk about that taking GABA, it doesn't get into the bloodstream, crossing the blood-brain barrier. Now, I have seen a lot of kids and a lot of people overall do remarkably well with lowering their anxiety from taking GABA. So I don't know how, if what's claimed that it doesn't cross over into the brain, how would it possibly be working? But I do think it's an incredibly, incredibly safe substance. It is definitely something that I bring into my practice. One of the things that you may have also heard me talk about in terms of lowering anxiety is the amino acid L-theanine, which, besides bumping up serotonin, it also bumps up GABA. So it's kind of like an indirect way of increasing GABA as well. But, and one of those things of risk versus benefits, it can make a person sleepy. Some people will even take GABA in order to help them go to sleep. But yeah, it's a pretty darn safe supplement for people to take. Okay. Oh, and I want to thank Shari Kulanu, who is, as you may know, my sister, but also the producer of the show, who is off screen feeding me all of these questions as they come in live. So the first couple questions that we did get them ahead of time, so I did get a chance to review a couple of those. But everything that we're going through now, I'm seeing them live as you hear them from me. Okay. What treatments have you seen bring the most improvements for children on the autism spectrum? Okay. Now, of course, coming back to the individuality that there's no one size fits all, but there are a few things that I have seen to be big winners. Now, going back to the very, very beginning of this, the first thing that I saw, which I would still say of all of the treatments that I've done, the single treatment that's helped the most number of children over the last 25 years of me doing this is antifungal therapy, and in particular, the medication called fluconazole. One of the few times that I am quick to use a medication is antifungal therapy. As many people know, a lot of our patients have had lots of antibiotics. That can lead to killing off the good bacteria. Babies who were born via C-section, or if the mom took antibiotics during delivery, they could have low levels of the intestinal flora. When there's low intestinal flora, then other things, what we call opportunistic infections, have the opportunity to grow. And these include things like candida and, to a lesser extent, clostridia bacteria as well. Going back to the beginning, that was the first mom of a child with autism said, "Hey, there's this test that you can do to check for yeast. Would you run it for my kid?" And we certainly learned about it. This was something that was commonly seen in neonatal ICUs and premature babies when babies get thrush, diaper rashes. It's yeast. So clearly, I had experience doing this, and the mom said, "Yeah, you just use the same antifungal medications," which of course I was very well versed in that from my time giving intravenous fluconazole to premature babies in the neonatal ICU, which I've always considered that's a pretty good way of knowing if something's safe to do. If you're comfortable injecting it into a premature sick baby, then you're probably okay with giving it to a healthy by oral child otherwise. But my goodness, the things that I've seen from taking antifungals. In fact, sometimes I'll have a parent will contact me and say, my kid's yeasty again. And there's no textbook definition, but they've seen their kids with yeast. They've seen their kids without. They know what they mean. I've learned to know what they mean. When parents first started to report this to me, I would say, okay, let's go ahead and get stool and urine tests to see if it's there. And then I learned relatively quickly that first year that the parents were right like 90% of the time. And then I said to myself, well, why am I spending several $100s and waiting weeks to get the results back for a treatment that I've already had success with and have given it to the patient and they did well? And so after about a year, I then transitioned over that if a parent told me that their kid was yeasty again and they did fine before it worked, I just put them back on the antifungal. But then, of course, I need to talk about, if it happens again, other things, dietary control, other things we can do to try to keep yeast from coming back. But that was really the first big bang that I saw. Casein and gluten-free diets. For those who don't know, in some children on the spectrum, they seem to not be digesting the casein and gluten proteins fully. They partially digest it, and they can form these opium-like substances that can cause brain fog, GI issues, behavioral aloofness, all of that. So that can be an incredibly helpful thing. I would say the next big thing that I saw was methyl B12, methylated B12. I mentioned, there are now, this is something that we historically have given by injection. The reason why is if you swallow methyl B12, it becomes demethylated in the gut and doesn't get into the bloodstream that way, especially if a person genetically can't reactivate it to methyl B12. We do use other ways such as nasal sprays, sublinguals, as ways of getting it into the body besides injecting it. But still, I've seen some rather amazing things in the injected form of that. And then more recently, I certainly will put a plug up for medical cannabis. It's the CBDs, combining them with the CBG for anxiety, combining it with CBN for sleep, and THC. Now, of course, we're always cautious about THC. We're concerned about giving developing brains THC. And of course, the kids that we are giving this to have developmental and problems where there's potentially serious violence and aggressiveness and irritability, just making it so tough to live with. And so we are improving quality of life. But my goodness, have I seen literally households kept together because the edge was taken off. I've seen kids not have to be institutionalized as teenagers when the hormones kick in because of medical cannabis and THC. So I would certainly say that, it's certainly up in my top few now. It's not getting to a root cause issue, but my goodness, you can see an improvement the first time out that you give it to somebody. And that's truly a blessing for a family who is so in need of support. Okay, so let's see if any other questions are here. Do you do allergy testing? That's a great question. Now, before I answer that question, I want to kind of take a bit of a deeper dive, because I don't look at allergies as a disease. I look at allergies as a symptom of something else going on. So again, vitamin D deficiencies, zinc deficiencies, leaky gut issues, intestinal health issues, correcting those things often will make those types of allergic reactions go away. Again, my corn allergy, perfect example of that. Got my vitamin D level up, no longer have a corn allergy. But if I've gone through that, yes, we can. I don't do skin testing in the office, but blood testing for IgE. What we typically do in our office is for inhaled allergies. There are actually certain allergens that you can do for indoor as well as outdoor. The outdoor certainly related to the area where a person lives. Obviously, the types of trees and weeds in here would be very different than a person in Colorado, for instance. So, of course, knowing where that is. When it comes to food testing, we actually have a checklist that we send to the patient or to the family, and all of the foods that are available for testing are on there. And then we just, I don't like to run a panel because maybe people never consume that food, but there can be some foods that most people wouldn't think of, and every now and then I will find a food that caused a problem. So we just basically have the parent or the patient check off all the foods, and then we order each of those antibody. IgE is what we're talking about when it comes to allergy. That's what causes histamine release and causes allergy symptoms. Now, it's also important to recognize that that's only one type of negative reaction. So a person, for instance, who has celiac disease, that's not an IgE allergy. That's a different type of reaction. Other IgG types of reactions can be a problem. A person can not be digesting their food properly, having a lactose intolerance, which is a dairy intolerance, but that is digestive, not immunological based. So, and for me, that's why if someone said to me, what do I think is the best allergy test? I would still come back to an elimination reintroduction diet, because if you remove all the potential allergens, people get better. And then you bring one back every 4 days and you notice, oh, there it goes. We, of course, want to stop that food right away. We wait for things to settle down before we go back into reintroducing the next food, because we kind of want to make sure that that's been cleared. And that's how we figured out. And again, that is how I found my corn allergy. I did not test positive for it. Okay. Okay, this looks like a little long one here. The U.S. Preventive Service Task Force, an independent panel of experts, came out with a recommendation today that pediatricians should screen children as young as 8 for anxiety and kids 12 and under for depression using routine well checks. The recommendation applies to all children 12 and over. The recommendation includes those who aren't showing any signs or symptoms of mental health. What are your thoughts on this? So this is something that we have definitely started to do in our practice. We are doing for preteens and teens these mental health questionnaires. We want the individual, the adolescent, the preteen to do the questionnaires themselves. We don't want the parents doing it, because sometimes things will come up or the parents may perceive things differently than the youth does. But yeah, this is something that we have started to implement in our practice. Also just kind of doing those types of check-ins as well. But the earlier we can find a mental health condition, doesn't mean that a person, of course, needs to be put on a medication. And of course, our biomedical approach so often does help improve those types of symptoms. But of course, if a person is having those types of symptoms, how incredibly important it is to be working with a therapist, someone who's versed in that condition, somebody who the patient bonds with and clicks with. Obviously, if it's a bad fit, sometimes it's a bad fit. Finding the right fit is important. Nowadays, people are doing more things via telehealth, but I realize sometimes people like to be face-to-face with people as well. But COVID did some messed up things to us besides child development and young children with their communication skills, being in mask. We, obviously, we won't get into the whole mask controversy, but certainly it is well known within pediatricians that was one of the things that did cause some social and communication delays in people. But at the same time, making sure that they're well taken care of from all of those different angles is just super important. But these so many kids, because it was drilled into them, how dangerous COVID was, how we had to watch out for it. You didn't want to bring it home to your parents and get them sick. Don't want to give it to your grandparents and who are more at risk, etc. So and even adults, let's face it, we all went, different levels of people anxiety over everything that's gone down in the past 2 years. But most people were impacted in some negative way from this. So yeah, that's why we're seeing much more mental health issues in our youth now than we were a few years ago. Okay, let's see if we have anything else here. All right. Maybe that's it. Shari, do we have anything else that's coming in? Oh, here we go. My son got COVID at the end of August. Let me try that go. Oh, this is our last question here. I see that. Okay. My son got COVID at the end of August and then has had 3 straight cold viruses. I worry he has been taking Chestol and Mucinex for about 2 months now. Have you seen an uptick in upper respiratory infections in the last 2 months? So while we have seen a significant reduction in COVID, I pulled our providers last week on this, and we can only think of like 1 or 2 cases that we've seen in the past few weeks. What we are seeing is a significant increase in other types of viruses, not influenza, but we are seeing rhinoviruses. We are seeing RSV, respiratory syncytial virus. That's the one, especially for young children, that can cause bronchiolitis, inflammation of the bronchioles and wheezing. And that can be rough, especially for the youngest of children's adenoviruses. So we clearly are seeing more of those viruses, which kind of makes sense. If people weren't sharing those viruses before, we would be sharing them eventually. It's common during a typical cold and flu season that a person can get back to backs. And in fact, it is felt that it is normal for a child to get between 10 to 12 viruses in a year. It does not mean that they have an that they're immunocompromised. And a cold congestion can last up to 2 weeks. A cough can even last past that. And so, of course, if you're having 10 infections and you're sniffly for 2 weeks each time, all of a sudden that's like 20 weeks out of the year that your kid is sick, and that may seem like forever. Questions that I come up to is, are they keeping the infection contained? Is it staying to just a general cold, or is it turning into pneumonias, God forbid? Is it turning into ear infections, etc.? Is it creating significant problems for the child? Then, of course, that is it. But, viruses are a point of life. It's it's a rite of passage. Until we have immunity to it, usually by older kids to have had immunity. As a pediatrician, I think that this is why I get sick so infrequently, because I've been exposed to viruses on the front line for the last 25 years. It's older people who immunity may have lasted, sometimes can get it, especially if they're exposed to a younger kid as well. But I've clearly seen that, and that's why one of the things that we also do in our cold and flu season, and this is something in one of our documents that we've shared as well, that there are certain things that we may do during the cold and flu season ongoing. Now, of course, we never do high-dose vitamin A for more than 2 days, although I have done it on and then off it for several days and have to go back on it again. But taking higher doses of vitamin C, taking higher doses of zinc, ideally knowing what your zinc level is and getting them optimized in the first place. Echinacea or arabinogalactan from the bark of the western larch tree, increasing white blood cell production. Elderberry, those types of things can also be very helpful in order to try to keep the immune system as strong as possible. But short of living in a plastic bubble, if you're susceptible to something and you get exposed to that, you're probably going to catch it. All right. Well, there we go. Thank you, everybody, for checking it out today. We will be posting this online, and we will be putting some of the questions forward. So again, please share this with other people. Tell people all about it, that they can log in and get some free educational advice from somebody that you probably like hearing from. So that's very nice. But again, shout outs to everybody for thanking you for being part of this, being members and subscribing to us. Thank you again, Shari, off screen, in order for feeding me all of this information. And it's been really great talking to you. And I look forward to talking to you guys again. Have a great day.